lightning strikes, it's important to know that lightning does cause quite serious injuries. A lot of times these incidents occur while on large events such as the 4th of July and picnics, and then inclement weather changes and it becomes an issue. And most people would tend to congregate and maybe even find some shelter under trees, or perhaps even sheltering under some type of shade tent out in the open. However, these lightning strikes tend to want to ground themselves, and when they do, they can also arc and spread across areas, causing them to strike the participants or individuals that have not removed themselves from the environment. In this one particular side, we see what looks like to be a post-mortem picture, a person that has probably been deceased. We can see blacked out the eyes, as well as there's an endotracheal tube and what looks like to be a security device around the mandible and oral area. We do see what's very apparent, this discoloration to the right trapezius, as well as the scapular and down on the right upper extremity, and more of this light discoloration crossing the upper right torso, just superior to the mid-mammary line, and looks like it doesn't cross over midline over the sternum much. This is a ferning pattern or a feathering pattern. As you can see, it does look like it kind of feathers out or ferns out like our ferns that you can see in Hawaii. So this might be the only indicator, other than that in the environment that the person is found laying in, there's a lot of electrical storms and thunder and lightning going around. What this electricity does is it affects not only the muscles and tissues, but as it strikes, it affects the cardiovascular system, and it can send people into sudden cardiac arrhythmia, causing them to go into ventricular tachycardia, ventricular fibrillation, which requires immediate defibrillation from an AED or an EKG monitor and defibrillator. So again, the electricity causes the heart muscle and the myocardium become very irritable, and it can send them into lethal cardiac arrhythmia, as well as causing more damage to the heart muscle because of the electrical discharge. This is also showing that not only does it affect the cardiac muscle, but it can affect the localized tissue and muscle in the area of that strike. A lot of times with electrical and electrocutions, where the area of there's an input and an output of electrical impulse. So we have a grounding position, and usually where the body is grounded, this may leave disastrous and large wounds, and even fracture bones because of the muscles that are all of a sudden twitching and then contracting violently during that electrical cution or electrical discharge state. Safety would be a major concern, but remember then that when we're treating these patients, that always is probably good to have your AED around, as well as the cardiac monitor, and then to do a good accurate history and physical exam.